Welcome to Fact Flash and you are watching Vadodara News. Let's take a look to the 4 major news making headlines in the city. Dhiraj Hospital under investigation for lying the state government about the treating of COVID-19 patient to get 2 crores. The demand for mucormycosis injections increasing the same way it was for remdesivir injection, 125 available against 1200 requirement per day. A nurse from Vadodara served the people selflessly by staying in hotel for 22 days, vaccinated 30,000 people in 5 months. Student from MS University upset from the state government for mass promotion, says if election can be done, why can't exams? And lastly, corona updates. Starting with the shameful news, in these difficult timings of COVID-19 and mucormycosis, where hospitals are temples and doctors are worshipped, a shameful news is coming from Dhiraj Hospital. Report says that Dhiraj Hospital lied to the state government about the number of COVID-19 patients just to get 2 crore rupees from the state government. And news says that Dhiraj Hospital often sent the families of the patients back, stating that the beds are fully occupied. But in reality, after the investigation, it came into light that the beds in Dhiraj Hospital are almost vacant. Let's take a look to the report. The management of Dhiraj Hospital told the families of the patients that all the beds were full with the intention of making millions of rupees by lying to the state government about the treating corona patients. OSD Dr. A.S. Vinod Rao said that in this way the amount taken by Dhiraj Hospital from the state government had reached to 2 crores. However, this amount will no longer be paid. Dr. Vinod Rao said the investigation was going on since the 13th when the scam was reported. Other teams investigated the scam in parallel. Teams were also formed by the district collect and DDO. When the team went to check Dhiraj Hospital, said there were 349 government and 120 paid beds with a total of 469 patients. The nodal officer was also drunk. The administrator of Dhiraj Hospital, Dr. Uma, did not even cooperate. Asking for the data 3 times, the data was not given yet. He also spoke at the higher level about such behavior of the authorities. Moving on, mucormycosis continues to frighten the nation. An alarming situation has arrived where the scarcity of amphotericin B injections continue to rise. If we talk about the city receives only 125 injections per day against the demand for 1200 injections per day. Vadodara alone needs 1200 injections a day as the number of mucormycosis patients in the city has reached more than 330. At the end, the government has given Vadodara only a stock of 125 injections of liposomal amphotericin B for the patients. The family members who have been suffering from mucormycosis in a private hospital for the past 2 days were outraged that the government was joking with patients suffering from mucormycosis. Doctors at government hospitals are also frustrated by the low volume but are sitting idly by with an average of 8 to 10 patients a day growing in the city. It is likely that more specialist doctors will be needed to operate on the SSG in the nearer future. OSD Dr. Vinod Rao said that 800 injections are required daily in SSG, but less than 200 are being received. Efforts are being made to resolve this matter, which is very serious. An incredible example set by a nurse from Vadodara by selflessly serving people for 22 days, staying in a hotel, vaccinated 30,000 people in just 5 months. She was herself a corona patient. After the recovery, immediately she resumed her job. In the first wave of corona, the GNM staff nurse who treated corona patients by staying in a hotel for 22 days has vaccinated 30,000 people in 5 months. Nurses working to vaccinate people against corona are proud of their duties. The GNM staff nurse Nayanaben Rana, who is on duty at Nagarwara Urban Health Center, has vaccinated 30,000 people in 5 months. As cases escalated in the new land, the entire staff did their duty by staying in the hotels instead of going home. While the staff of Nagarwara Urban Health Center was engaged in corona testing from July-August. Nainaben tested positive in November but was admitted to the hospital for 6 days. She returned to the duty immediately after recovering from the corona. Yesterday, the state government announces the mass promotion of 25,000 students of MS University. Now, the students of MS University are upset by the decision of the government, demands exam, says if elections can be done, why can't exams? Mass promotion has been announced for the students of college and universities, which has been opposed by students and former Senate syndicate members. He says, if there is an election, why not an exam? Students protagonist Pankaj Jaiswal had filed an application in this regards also. The government's decision has to be accepted, said Registrar Chudasma. The decision should be left to the VC of each university. Online examination education is going on smoothly by the universities. The government should allow the VC of each university to take a decision. Deepak Shah, former Senate syndicate member, says mass promotion should be the last option. Now let's take a look to the corona updates. The city is recording a continuous decline in the number of coronavirus cases. If we talk about last 24 hours, the number of fresh coronavirus cases are 792 with 6 deaths.